Hi there, my name is Deirdre McCartan and I'm the researcher who's organising this study. Thank you so much for taking the time to watch this video. The goal of this study is to improve acute stroke care in Ireland. The title of the study is Maximising Equity and Accessibility of Acute Stroke Care Pathways in Ireland. And really what that means is we want to increase the number of people who get into hospital as quickly as possible if there's any chance they might be having a stroke. So when we talk about a pathway of care, we mean from the very moment that symptoms of stroke start to a person calling for help, for an ambulance being dispatched, that ambulance coming to the house, and then delivering the patient to the hospital for their acute care. So we want to look at that pathway in a step-by-step way and see where along those steps might we improve efficiency to make sure that everything happens as quickly as possible. So the way we want to do this is in two parts. The first part is a survey. So we want to talk to about 100 people who come into hospital with an acute stroke. So that's a stroke that's happened very recently. And we want to do a survey with them, which is a series of questions. And these questions will ask them details about what happened around the time of their stroke. The second part of the study is where we will talk to a number of the people who took part in the survey 3 months later. And that will be an interview, so a more detailed conversation, maybe even over a cup of tea at home, 3 months after they've had their stroke. And we'd like to talk to them in detail about what they might be able to tell us about what the challenges were that they faced at each point of their stroke journey or their stroke pathway. And we feel that by talking to people who've recently had a stroke very early on, and then again 3 months later, with the benefit of hindsight, we will be able to learn from their experiences. We feel that by talking to quite a number of people, we'll be able to see patterns in their stories, which will give us insights into what the challenges or obstacles were, or even what the opportunities would be for us to perhaps improve things, to make things more efficient for other people who have a stroke in future. So thank you so much for taking the time to listen to this video. There is more information available on the poster or on the information leaflets. So please do get in contact if you want to have any more information about the study. Please do understand that this is totally voluntary, and if you choose to participate or you decide not to participate, it won't affect your care at all. Okay, so thank you so much for taking the time to listen to this video.